Magandang araw sa inyong lahat and welcome to the second pre-recorded lecture of the subject Clinical Practicum 101B. So last time, you learned about the third stage of labor, and this time we will be talking about the active management of the third stage of labor. Now, what does AMTSL or the active management of the third stage of labor mean? A birth attendant applying active management of the third stage of labor is the key to reducing the risk of complications. Anong ibig sabihin nito? That we midwives play a big role when it comes to reducing the risk for complications, especially if the mother is in the third stage of labor or during the placental delivery. So what's very special about the AMTSL? The term active management simply indicates that you are not waiting for spontaneous delivery of the placenta. Gaya nga ng sinabi natin last time na ang midwife should be watchfully waiting. In the active management of the third stage of labor, the midwife is not waiting anymore passively. Instead, she is actively delivering the placenta. So sabi dito, rather, you will intervene in a carefully programmed sequential manner as follows. So dito sa active management of the third stage of labor, we follow certain steps, procedures, and management so that we can decrease the risk of complications. So what do? As soon as the baby is delivered, we put the child on the mother's abdomen in skin-to-skin contact and cover them with a blanket. So bakit natin sila ilalagay si baby sa abdomen ni mother? Because we want to promote thermoregulation para hindi ginawin si baby. And then we also keep them in skin-to-skin contact and then we cover them with a blanket again. Gusto natin na hindi ginawin si baby so that the child will not suffer from hypothermia. So that's the first thing that you do after the delivery of the baby. The next thing you should do is clamp the baby's umbilical cord at two sides and then cut it in between. So if this is your umbilical cord, you place the Kelly forceps here. You also place the umbilical clamp here. And then you cut it in the middle to prevent bleeding. All right, so that's what we do in the active management of the third stage of labor. Those are the first things that we should do. Now, so after doing that, after placing the child in the abdomen of the mother, placing them in skin-to-skin contact, and giving them blanket, and then cutting the cord, the next thing that we are going to do is you check the uterus for the presence of a second baby, or what we call multiple pregnancy, because there are some patients who will deliver twins, and sometimes these patients do not undergo ultrasonography, so the midwife does not have any idea that there is a second child. So you have to check the uterus for the presence of the second baby. Okay, so sabi dito, immediately after the birth of the baby, check for the presence of a second baby. By how will we do that? By palpating the uterus through the mother's abdomen. So you will just palpate it, mapifeel mo naman using both of your hands, you can feel that there is still another baby inside. So palpate for the head. Usually it's round and hard. So makikita mo, meron pang ulo dito sa loob. So ibig sabihin there is still a second child. Now, when you are sure that the uterus does not contain a second baby, immediately go to step 2. Pero pag meron pa ring bata, okay, you deliver the baby first. So the reason for checking carefully is because in your step 2, we will be introducing drug to the mother, which is your oxytocin. Ang gagawin kasi ng oxytocin mo, it will stimulate the uterus to contract. Okay? So anong mangyayari pag bibigyan mo siya ng oxytocin? The uterus will contract so powerfully that it will damage the baby that remains inside. So ayaw nating mangyari yon. So we deliver the child first before giving the drug. Alright? So, or before going to step 2. If you find that there is a twin, sabi dito, you deliver the second baby before proceeding to the step 2. So that is your first step in the active management of the third stage of labor. Check the uterus for the presence of a second baby. Next, in less than 1 minute after delivering the baby and checking that there is no second baby, administer what we call the uterotonic drug. Okay? So what does these drugs do? They are hormone-like chemicals that make the uterus contract more powerfully. The most commonly used uterotonic drugs in obstetrical practice are misoprostol, your oxytocin, and ergometrin. So both of them are injectable, yung oxytocin and ergometrin, while your misoprostol are tablets. So that is more popularly named as your cytotec. Okay. So iba-ibang pangalan, iba-ibang klase, but all of them stimulate the uterus to contract. Like I said, hindi po tayo pwedeng mag-deliver ng placenta if there is no active contraction of the uterus. That's the reason why we give the mother these drugs, one of these 3 drugs during the active management of the 3rd stage of labor. Now, these drugs are given to the mother to help the uterus continue contracting strongly and rhythmically after the baby is born. And these drugs facilitate the placental delivery and also to help prevent excessive bleeding from a relaxed or atonic placenta, because sometimes there are patients whose uterus will stop contracting after you deliver the baby. So what's gonna be the problem if the uterus remains contracted, relaxed, I should say. If the uterus remains relaxed, you cannot effectively deliver the placenta, because if the uterus is relaxed and you pull the umbilical cord to deliver the placenta, tendency is the placenta will come out along with the relaxed uterus. That is what we call uterine inversion. So gusto nating bigyan ng gamot si nanay after niyang ipanganak yung bata, we give her drug to stimulate the uterus to contract. In connection, the oxytocin is the drug recommended by the World Health Organization, and it is the most common drug used in the hospitals. So if you go for duty, you can expect that the hospitals or the doctors will recommend or will order oxytocin instead of misoprostol and ergometrin. So, tatandaan nyo lagi yan ha. Oxytocin ang pinaka-common na ginagamit natin in the 3rd stage of labor. Now, you have to remember that oxytocin and ergometrin always have to be kept in the refrigerator for a temperature of 2 to 8 degrees Celsius. And they are not usually suitable for home delivery kasi wala naman usually pag pumupunta tayo sa mga bahay-bahay, wala naman tayong access sa refrigerator. Unless otherwise, if you have a mobile ice box so that you can keep the oxytocin or ergometrin inside. So, dapat meron kayong ice box to protect them from exposure to heat or light, because if these drugs are exposed to heat or light, they become destroyed. So always remember ha, oxytocin and ergometrin needs to be refrigerated. Now, in connection with the dosage of the uterotonic drugs, what we do is in less than 1 minute after delivery of the baby and after we have already clamped the cord, we give the mother either one of this. Ibig sabihin, isa lang sa mga tatlong ito ang ibibigay natin. Either you give misoprostol, oxytocin, or ergometrin. Isa lang bawat sa tatlong to. Hindi mo pwedeng ibigay siya ng pagsabay-sabayin. Okay? So you can give misoprostol to the mother. Ilang misoprostol ang kailangan niya? It's 600 micrograms. Always remember that 1 misoprostol comes at 200 micrograms, okay, per tablet. So, ibig sabihin, isang tableta ng misoprostol ay 200 micrograms lang. So, how much do we need? We need 600 micrograms. So, anong ibig sabihin nito? We will not just be giving the mother 1 tablet kasi 200 microgram lang yon. Instead, we will be giving the mother 3 tablets to meet the requirement of 600 micrograms of misoprostol. Next, we can also give the mother oxytocin, and we give 10 international units that is injected naman to the mother's thigh or to the mother's deltoid muscle. So, saan natin siya binibigay? Either sa thigh or sa upper arm ng nanay, malapit sa shoulder. Okay, so ilan yung ibibigay nating units? 10 international units of oxytocin. Next drug is your ergometrin. So how much do we need when we are giving ergometrin to the patient, we give 0.4 to 0.5 milligrams injected also in the woman's thigh or in the woman's deltoid muscle. So you have to double check the preparation of the drug for you to know that you are really giving 0.4 or 0.5 milligrams or 10 international units of oxytocin or ergometrin. So those are the dosage. Dapat you should not overdose the patient with oxytocin, misoprostol, or ergometrin, or else masyado nang malakas yung kanyang contraction. That's what we call tetanic contraction. And hindi yun maganda because the mother will have difficulty of delivering the placenta kasi nga sobrang contracted na ng uterus na it will no longer release the placenta. Aside from that, when the uterus is well contracted, remember that after giving the drug, the uterus will feel very hard. This should occur after 2 to 7 minutes after mong ibigay yung gamot. So, do not expect that after you give the drug, the uterus will immediately contract. No. You will have to wait for 2 to 7 minutes after before the drug sets in. So, pagkabigay mo ng gamot sa kanya, you will have to wait for 2 to 7 minutes bago mag-take effect yung gamot, and then the uterus will now start to contract. So that is the use of your uterotonic drugs, misoprostol, oxytocin, and ergometrin. After delivering the baby and after checking for the second baby, and after giving the medication, uterotonics to the patient, the next thing that you are going to do in your active management of the third stage of labor is applying controlled cord traction. So when the uterus is well contracted, like I said, it will feel very hard and it should start contracting from 2 to 3 minutes after giving the uterotonic drugs. What do you do after? If you already see that the uterus is contracting, then it's time to apply controlled cord traction with counter pressure. This is done to expel the placenta. Always remember that the focus of your step 3 in your active management of the third stage of labor is delivering the placenta. Now, bakit tayo magbibigay ng controlled cord traction or bakit natin hihilain din si uterus pataas habang si placenta hinihila natin pababa? We want to do that to avoid uterine inversion, or we do not want to turn the uterus inside out, or we don't want it to come out of the vagina with the placenta. So, what do? We apply controlled cord traction, but you should only apply controlled cord traction with counter pressure to the abdomen. So, ganyan po yung ginagawa natin. The dominant hand, which is the one holding the umbilical cord, is applying a downward motion to the umbilical cord and the placenta, while the non-dominant hand is applying counter traction. Okay, so the midwife is pushing the placenta upward and backward so that the uterus will not come out along with the placenta during your step 3 in AMTSL. Now, how do we do the controlled cord traction with counter pressure? These are the steps. Number 1 is we want to clamp the umbilical cord as close to the perineum as possible. Okay. And you hold it with your dominant hand. Number 2 is you place the other hand just above the woman's pubic bone or your symphysis pubis. Dapat nandun po yung non-dominant hand mo. And stabilize the uterus by applying counter pressure to the abdomen during controlled cord traction. So ulitin natin ha. Sa step 1 is you clamp the cord as close to the perineum as possible. And yung second hand mo, which is your non-dominant hand, should be on your symphysis pubis bone on top of that. And then you feel for the uterus. Habang finifeel mo yung uterus, you push the uterus upward and backward. That's what you call your counter pressure. Okay? while doing your controlled cord traction. So habang hinihila mo si cord pababa, which is your controlled cord traction, you also apply counter pressure to the abdomen. And then also, keep slight tension on the cord and wait a strong uterine contraction to occur before pulling it. Always remember that your contractions usually appear with an interval of 2 to 3 minutes. So pag nag-contract siya ngayon, after that, mag-rest konti yung uterus, and then after 2 to 3 minutes, magko-contract siya ulit. So what do? You just hold the cord with a slight tension. Medyo nakahila siya, you hold it taut. Ang ibig sabihin, nakasdiretso yung inyong cord. Nakastraight lang siya. And then pag magko-contract na si uterus, that's the time that you again pull. Remember that you should not be pulling the umbilical cord if there is no uterine contraction. Now, with the strong uterine contraction, you also encourage the mother to push and very gently pull downward the cord to deliver the placenta. So what can you do? You can say, Mother, pwede kang umirin ng konti, pero dapat hindi niya lakasan yung pag-ire. The pushing or bearing down of the mother should only be very gentle so as to control the delivery of the placenta. So continue applying counter pressure to the uterus while pulling the placenta downward. So that is how you do it. While the baby is inside the blanket, naka-skin-to-skin contact si nanay at si baby, the midwife is pushing the uterus backward and downward, right? While the midwife's dominant hand is holding the umbilical cord downward. So that's how we do it in your controlled cord traction. Now, after that, between contractions, you gently hold the cord and wait until the uterus is well contracted again. So like I said a while ago, you should still apply a little tension while holding the cord while waiting for another contraction. And then, if the next contraction arises, repeat controlled cord traction with counter pressure. So dapat ginagawa mo lagi ito. Pag may contraction, what do? You pull the umbilical cord downward, and then your other hand should apply pressure backward and upward to the uterus. So mag-cord traction ka and counter traction para mailabas ng maigi si placenta. If the placenta does not descend during the 30 to 40 seconds of controlled cord traction, do not continue to pull the cord. So pag nakikita mo during one contraction, nagpupull ka downward, nagpupush ka ng placenta ng uterus backward, and then you can see that the placenta is not descending or hindi siya bumababa. What do? Do not continue pulling on the cord. Baka ibig sabihin yan, hindi pa masyadong nakapag-separate si placenta and si uterus. So you just give it a little more time. Maghintay ka lang ng konti, and then eventually, the placenta will also descend. The following actions complete the rest of the delivery of the placenta. So pag inuulit-ulit mo ito, you can be sure that the placenta will be delivered immediately after. As the placenta is delivered, it should be caught on both hands at the vulva to prevent the membranes from tearing and some being left behind. So, di ba nagkikita natin yung arrival of the placenta on the vaginal canal or yung tinatawag nating peeping. Okay? So, pag sumisilip na po si placenta in the vaginal canal, what do? Your hand should stop. Your non-dominant hand should stop your counter traction, and anong gagawin mo? Yung isang kamay mo will go down to the perineum and hold the placenta there. So, hihintayin mo siya, and then while the placenta is coming out of the vagina, dapat you twist the placenta or rotate it clockwise or counterclockwise. So, iikot-ikutin natin siya palabas. So, bakit natin gustong gawin ito? Because we want to prevent the membranes of the placenta from tearing, or we don't want some of it to be left behind. So, hold the placenta in 2 hands and gently turn it until the membranes are twisted so that all of the cotyledons will come out without any sign of tearing. Kasi ayaw natin may matirang placental fragments sa uterus because it will only lead to what? It will lead to bleeding and infection. So we want to prevent that by holding the placenta with both hands and then twisting it gently to deliver the placenta. And then slowly pull the placenta to complete the placental delivery. And what do? You call out the time of placental delivery. So placenta out at 12:10 p.m. So i-call out mo siya after the full delivery of the placenta. So like that, you hold your placenta with both hands and then rotate it either clockwise or counterclockwise. It doesn't really matter kung magka-clockwise ka ba, magka-clockwise ka or magka-counterclockwise ka. It doesn't matter as long as you twist it gently so that you will prevent the tearing of the placental cotyledons. Okay. After the delivery of the placenta, immediately starts the massaging of the uterus. Like I said, we need the uterus to contract immediately after you deliver the placenta, or else the patient will experience bleeding. Okay? So what do? We rub the uterus, okay, to help it contract and to stop bleeding. And many women need their uterus rubbed to help it contract. Kasi after the placental delivery, tendency is nagre-relax na si placenta. So what should you do? You can rub the abdomen of the mother, feel for the placenta, and then rub it gently. And then, kung meron ka pang ginagawa, you can also ask the help of the mother. Sabihin mo, Mother, palpate for your uterus. Mother, ito po yung uterus mo. Please rub your uterus to help your uterus contract para hindi ka mag-bleeding. Alright, so you have to ask the help of the patient. So what do? In massaging the uterus, number 1, you massage the uterus immediately after the delivery of the placenta and membranes until it is firm. And next, after stopping the massage, it is important that the uterus does not relax again. Kasi may mga pasyente na pag minamassage mo yung abdomen or yung uterus, tumitigas siya. Pero pagkatapos mong i-massage, magre-relax ulit yung uterus. That's not what we want to see. Dapat, pag minamassage siya, nakakontract. Pag tinigil mo na yung massaging, nakakontract pa din. That is our goal as midwives during this phase. Or else, pag minasage mo, and then nakita mo nag-contract, and then tinigil mo na yung pagmamassage, hindi mo nakita na bumalik pala sa relaxation si uterus, tendency is magbi-bleeding ngayon yung pasyente nang hindi mo alam. So you have to double check and reassess the uterus and make sure that it is contracting even without the uterine massage na ginagawa mo na. Also, part of your massaging the uterus will include step number 3, which is to palpate for contracted uterus every 15 minutes and repeat uterine massage as needed during the first 2 hours after childbirth. So what do we do as midwives? Kapag napanganak na kasi yung bata and na-deliver na si placenta, what we usually do is we check the vital signs of the mother every 15 minutes so that we can note if the mother is really adjusting towards recovery. Kasi pag magde-decline yung kanyang vital sign, we immediately report to the doctor because the patient might be experiencing some sorts of complication post-NSD or pagkatapos niyang manganak. So we check the vital signs every 15 minutes. So pag i-check mo na yung vital signs, it is very important for you to also double-check the state of your uterine contraction. You go to the mother, get the vital signs, and then you also palpate the uterus mother. Do you feel your womb? Yan po yung round and hard. You check it after 15 minutes. Kung nagko-contract siya ulit, dapat diretsyong nagko-contract yan. Okay? If not, you softly rub the womb until it gets hard again. So ginagawa natin yan every 15 minutes for the first 2 hours. Then you instruct the woman how to massage her own uterus and ask her to call if her uterus becomes soft. So dito po pumapasok yung role din ng mother and yung role ng significant other. Because you have to remember that there are also other patients in the hospital and you cannot stay there in the room of the mother just simply rubbing. Nirarab mo na lang yung abdomen ni mother to prevent the uterus from relaxing. Hindi po pwedeng ganon na yun na lang yung ginagawa mo per duty. So what do? You ask for the cooperation of the mother and you say, Mother, tulungan mo po ako. Dapat yung uterus mo, nagko-contract yan, i-feel mo, dito mo po siya makikita or dito mo siya mararamdaman. Dapat it should not become soft and you should remember to massage it very so often. Pero pag na-feel mo siyang nag-soften at nag-relax, mother, you can let your husband call us. So sabihin mo, Mother, tawagan niyo lang po kami kung merong paglambot or pag-relax ng uterus so that you can give appropriate drugs immediately. Now, step 5 of your active management of the third stage of labor is examining the placenta to make sure that it is complete and none of it has been retained inside the uterus. So, checking for the completeness of placenta ang focus naman ng step 5 ng ating AMTSL. You must look carefully at the placenta to be sure that none of it is missing. So, ano yung tinitignan natin? Tinitignan natin yung cotyledons. If a portion of the maternal surface or the bottom of the placenta that is raw and dirty is missing, or there are torn membranes with blood vessels, makikita mo naman siya merong parang punit or meron parang siyang missing na segment, you suspect for retained placental fragment that remains inside the uterus and refer the mother quickly to the doctor. Sabihin mo, Doctor, the placenta is not complete. So, anong gagawin ni doctor? The doctor will do manual evacuation of the placental fragments. So, report immediately pag nakakita kayo ng ganito. The irregular round shape of the underside of the placenta are called lobes, or some textbook, they call them cotyledons. So, anong itsura nito? Ito yung mga tinitignan natin if we are inspecting the placenta. We look for cotyledons or what we call lobes. So, this one is one lobe. The other one is another lobe. So, pero makikita mo dito, parang meron siyang missing. Okay? Parang kulang dito. So, upon inspection and there is a missing lobe in the placenta of the mother, immediately report it to the doctor so that the doctor can do appropriate care and management to the patient. So, number 5, step in your AMTSL is checking for the completeness of the placenta. Now, how do we check for the completeness of the placenta? These are the things that you need to do. Number one is you have to hold the placenta in the palm of your hands with the maternal side facing upward. So, naalala nyo po ba yung Duncan presentation na sinasabi natin? So, dapat yung dirty, raw, and red ang nakikita nyong side. Okay? And make sure that all the lobules or nodes or cotyledons or segments are present and they fit together. So, dapat nakikita mo kompleto lahat yon at wala siyang mga tearing or mga sugat-sugat. Number two, hold the cord with one hand and then allow the placenta and the membranes to hang down. So, i-hold mo si placenta using the cord and then hahayaan mong bumaba yung mga different membranes doon. And then place the other hand inside the membranes and then spread the fingers out to make sure that the membranes are complete. And then hold the membranes open like this to check for completeness. So, anong ibig sabihin? Ganito po. So, isi-spread mo yung membranes and then dyan mo makikita pag kumpleto ba yung placenta or hindi. So, after inspecting kung kumpleto nga ba yung cotyledons, so ito po yung mga cotyledons na tinatawag natin, right? Dito po. This is what you call your cotyledons. And then this side naman, these are what you call your placental membranes. So, tinitignan mo din kung kompleto ito or pag may tearing ba. So, in this case, meron po bang tear? Yes, meron. Makikita nyo meron parang missing segment dito. So, you report immediately to the doctor so that the doctor can do manual evacuation and the doctor will insert his or her hand in the uterus. And then, hahanapin niya kung saan nakalagay yung placental membrane na hindi natanggal. In connection with checking for the completeness of the placenta, you also have to note the position of cord attachment to the placenta. So, titignan natin kung saan naka-implant yung umbilical cord. Anong ibig sabihin nito? So, kunwari, this is the placenta. Okay, pabilog siya kunwari, di ba? Normally, the cord implants in the center. Sa center siya naka-implant talaga ng placenta. That's the normal attachment of the cord and the placenta. So, pag nakita mo na yung placenta ay nandun sa gilid or nandun mismo sa margins, yung cord niya, alright, you report it immediately to the doctor. Kasi pwedeng isa itong abnormality and it may present a different medical condition. So, maaari yung bata or yung pinanganak pa lang na baby, meron siyang heart disease because of the poor attachment of the umbilical cord to the placenta. So, immediately report the improper cord attachment to the doctor. Aside from that, after mong i-cut po yung umbilical cord, you also have to check for the presence of two arteries. Okay? So, dapat, pag kinat mo yung cord, meron siyang two arteries and also one vein. So, ang clue natin dyan, kasi it comes out in the board exams, our clue there is AVA. Okay? Bakit siya AVA? Dalawang arteries, isang vein. So, pag ito yung cord, kinat mo siya, dapat sa loob, makakita ka ng tatlong blood vessels dyan. Two arteries and one vein. I will show you a picture of it later on. Next, you have to safely dispose the placenta by either burying it, where it will be not dug by animals, or you have to incinerate it. Pwede mo nyo siyang pasilaban sa apoy. Okay? If your community have facilities to do it. If the membranes tear, gently examine the upper vagina and cervix of the woman. Ito yung sinasabi ko kanina na pag nagde-deliver tayo ng placenta, you have to also check for the membranes for its completeness. You must wear sterile gloves or disinfected gloves and use a sponge or forceps to remove any piece of membrane that are present. Usually, these membranes are very slippery. Hindi mo siya kayang hilain using your hand with gloves. So, kukuha ka dapat ng operational sponge or gauze in English, and then yun yung gagamitin mong pang-pick sa membranes na hindi natanggal. Alright? And note that it is dangerous for the mother if any parts of the placenta or membranes are left behind the uterus. Bakit nga? Sinabi ko, it will lead to relaxation of the uterus, it will lead to bleeding, and it will lead to infection pag merong natirang placenta or placental membranes in the uterus of the mother. Okay, mabalik tayo sa AVA na tinatawag natin kanina. So, if you cut the umbilical cord, you also have to check for the presence of the 3 blood vessels. So, nakikita nyo, 2 artery na maliliit, 1 vein. Yan yung normal na makikita nyong blood vessels in the umbilical cord. After inspecting the placenta for its completeness, the next thing that you are going to do is examine the woman's vagina, the perineum, and the external genitalia for any laceration and active bleeding. Especially if the woman is primiparous or ibig sabihin first pregnancy niya, first delivery niya, you can expect that the size of her vagina is too small for the size of the head of the baby. So tendency pag lumabas yung ulo ng bata sa vagina ng mother, it will cause lacerations or tearing of the muscle. In Ilocano, what we call mapisangan ni mother. Okay? So this is one way to complete the management of the 3rd stage of labor by checking for lacerations. Ano ba yung ginagawa natin? Number 1, you gently separate the labia minora and labia majora and inspect the lower vagina and the perineum for lacerations that may need to be repaired to prevent further blood loss. Always remember po ha na yung bleeding hindi lang nanggagaling sa uterus. It will also come from the lacerations. So, kunwari masyadong malaki yung bata, and then nag-create siya ng laceration sa vagina habang lumalabas, napisangan ni mother. Now, makikita mo that there are blood vessels that are oozing with blood. Makita mga adda ti darang arumrumar di jayan ti lasag ti vagina ni mother. And you have to close it. Dapat tinatahiyan so that we want to prevent blood loss. And how do we check for lacerations? Dapat sineseparate natin si labia majora, labia minora, pinaghihiwalay natin. So, in Ilocano, bukiradem, the vagina, with both of your hands. And then inspect for lacerations in the perineum. Okay? Or minsan, umaabot din siya hanggang sa anus. So, those are the extensive lacerations that are seen in the mother. Next. Pag nakita mo siyang merong laceration, you gently cleanse the vulva and the perineum with boiled and then cooled na warm water. Bakit natin siya i-boil? Kasi ayaw natin na may mga microorganisms doon. So we have to boil the water first, let it cool down, and then that's already a sterilized water. So pwedeng yun yung gamitin natin pang cleanse sa vagina or vulva. And then we can also use a weak antiseptic solution. Okay. So, ito po yung example ng isang vaginal laceration or postpartum laceration. So, ang gagawin mo is you have to separate both labia minora and labia majora, so bukiradem detoy, and then titignan mo yung extent ng laceration. So, titignan natin dito mukhang second degree laceration kasi umabot siya hanggang sa muscle. Okay? So, ito po yung anus ng mother. So that's the 2nd degree laceration. So kailangan na ng mother ng suturing or repair of the laceration. Now, isa pang pwede natin gamitin as cleansing agent in your vagina before the suturing is what we call potassium permanganate. Ito yung chemical that is as a weak antiseptic solution or mild na antiseptic solution. Ang ginagawa natin is we get a small amount of potassium permanganate and then add it with 1 liter of water. So ito yung concentrated version. Ito po yung diluted version. Okay? So ito po yung gagamitin nating panglinis or pang-flush sa vagina ni mother before we suture it. So bago natin tatahiin, lilinisan muna natin using potassium permanganate. Now, still on the topic of examining for laceration, you also have to apply a clean pad or cloth with firm pressure on the area that is bleeding for about 10 minutes. So, pag mag-check si doctor ng laceration at pag may makita kayong laceration and then hindi pa ready yung mga ginagamit nating pang suturing, di ba? So you can put a piece of sterile cloth or OS on the vagina of the mother kung saan merong bleeding and then i-press nyo doon for 10 minutes. That will stop the bleeding. Okay? If bleeding continues after this time, you refer immediately to the woman and keeping the pressure applied to the wound. So, pinipress natin dapat yung sugat kung saan merong bleeding, active bleeding, because you want to close the blood vessel there. Kasi pag hindi natin prines, hindi natin in-applyan ng pressure, it will continue bleeding and it will now lead to hemorrhage to the mother. So, ayaw nating mangyari yon. So, dapat pinipress natin siya firmly for 10 minutes and then pag 10 minutes na, pwede mong tanggalin, silipin mo if it will stop bleeding or not. Pag hindi, refer it immediately to the doctor kasi ibig sabihin kailangan talagang matahi or masuture ng vaginal laceration na yon. Number 4 is we monitor the woman every 15 minutes. So gaya ng sinabi natin kanina with your uterine contraction, dapat minomonitor din natin si nanay. We measured her vital signs, we massaged the uterus to ensure that it is contracting, and you also check for excessive vaginal bleeding. So pag tinahina ni doctor yung vaginal laceration and then sinilip mo siya after 15 minutes, meron pa ring bleeding na nangyayari. What do you do? Report to the doctor immediately. Bakit? Because there might be still lacerations that are kept unsutured. Baka meron siyang hindi nakita na sugat or laceration na hindi pa niya naayos or na suture. So report immediately. So yan yung importante, you check the mother every 15 minutes kasi ito yung pinakadelikadong part after the delivery on the first 2 hours. Kasi dito lalabas yung mga complications. So again, every after 15 minutes for the first 2 hours, check the vital signs of the mother, massage her uterus, and then check for excessive vaginal bleeding. So, ito, mas clear po ito. But this time, I think this is only a 3rd degree laceration po siya. Kasi umabot po hanggang anal sphincter. Okay, so makikita nyo medyo deep siya. Okay, kasama po sa muscle. Okay, so tignan nyo na tear din yung perineal muscle. And then pati yung anal sphincter is na nagkaroon din ng tearing or laceration. So this is already a 3rd degree laceration. Pag umabot siya hanggang dito, that is now what you call your 4th degree laceration. I'll just give you a quick trivia about the placenta and its importance to the culture of other countries. Always remember that the placenta has little to no importance after the delivery of the child. So, lagi niyong tatandaan na yung placenta, after it delivers oxygen and blood to the growing fetus, and after the child comes out, it is no longer important to the body of the mother. However, there are some countries that have these kinds of superstitious belief, and they think that if they treat the placenta well, it will also lead to a positive outcome for the child. So, example, for the Philippines, it is believed that when you bury the placenta, it will ensure that the child will grow healthy and strong. There are even some cultures in the Philippines wherein they also place dictionaries, newspapers, and pencils along with the placenta before they bury it because they will believe that the child will grow to be very intelligent. Pagbibigyan nila ng newspaper, ng libro, yung placenta bago nila ilibing. And in some parts of China, the placenta is cooked and even eaten by mothers because it is believed to have many nutritional properties. So, iuwi nila yon, yung mga iba ibe-blender, yung mga iba icha-chop, ilalagay sa spaghetti as their meat replacement. So if it's part of their culture, you don't say, "Yak, ano ba yung mga pinagagawa nyo?" Or, hindi yun totoo. You don't have the right to do that as a midwife. always remember that we should respect their cultural upbringing and their religious beliefs without prejudice. So what do? In dealing with these kinds of patients, be sure that you as a midwife still respect their cultural beliefs and traditions while following the standard precaution and hospital policies. So kung sa hospital nyo, pwede namang ipauwi yung placenta sa mga pasyente kung gusto nilang iuwi, then by all means, you give them the placenta that they are asking for. Kasi like I said, dapat we do not only care for the health of the mother physically, but we also care for them socially, culturally, and things like that. So, yan po yung trivia natin ngayon regarding placenta. Okay, so makikita nyo dito si mother, kinakain niya yung placenta niya bilang sushi. Iyak ba yan? Para sa atin, maybe, but again, as midwives and healthcare providers, we should always respect the culture of the patient. And that concludes our second pre-recorded video on the topic, active management of the third stage of labor. I hope you had fun as much as I did. I'll have to make a quick assessment on how much you have learned regarding our session together. I will be uploading a quiz on your Edmodo classroom. For those of you who have not yet accessed Edmodo, you can still take the quiz by sending me a private message on your Facebook Messenger. Again, maraming salamat for watching. Thank you for your time. Keep safe and stay alive. God bless.